Hello everyone, myself Prishita, Assistant Professor working in the Department of Pharmaceutical Chemistry and Analysis, Wales Institute of Science, Technology and Advanced Studies. And today my topic is on anti-anginal drugs. Today we are going to say about the introduction, classification and mechanism action of anti-anginal drugs. What is meant by anti-anginal drugs? Anti-anginals are those that prevents or terminates the attack of angina pectoris. Angina pectoris, it is usually referred to as an angina, which denotes a severe chest pains, which is caused by the lack of blood and the lack of oxygen supply of an heart muscles. This ischemia is a result of obstruction or a spasm of coronary artery, and thus the main cause of angina is coronary artery disease, which results from the atherosclerosis of cardiac arteries. And types of angina pectoris, there are four types. First one is a classical angina, unstable angina, and variant, and also a silent angina. What is in the classical angina? Which occurs due to the increase in the cardiac workloads like an exercise and emotional stress and cold condition. Even cold condition also leads to a classic. And here atherosclerosis is the main reason. And unstable angina, which is attack in rest condition also, occurs due to the extensive coronary artery blockages due to atheroma and then vasospasm, which was treated by the vasodilative and antiplatelet drugs. And next is a variant, which is an unpredictable and attack during the sleep and rest. Here the coronary vasospasm is the main reason, which is caused by stress, cold, smoking, etc. And then elevation of the ST segments in ECG also, which was treated by a vasodilators. Next is silent angina, which is ischemic without any symptoms, which is called as a silent angina. Next, we are going to see about the classifications. There are four main classifications, which was classified according to the chemical structure. First one is nitrates, beta blockers, calcium channel blockers, and potassium channel blockers. First, we'll see about the nitrates. Nitrates are again which is classified into short acting and long acting. First, we'll see the short acting. Example of a short acting is a glyceryl trinitrate. Here it is a structure of glyceryl trinitrate. Here we can see if all the nitrate NO2 it was replaced by H hydrogen, then it is a glycerol. But instead of H, here all are substituted by then nitrate groups. That's why it is a glyceryl trinitrate. And next is a long acting, which is the isosorbate dinitrate, isosorbate mononitrate, erythritryl tetranitrate, and penta-erythritryl tetranitrate. And this is the structure of isosorbate dinitrate, and this is the structure of isosorbate mononitrate. Here it was formed by the dehydration within the sorbitol and forms as ring structures and the nitration happens, which gives us an isosorbate dinitrate and isosorbate mononitrate. And this is a structure of an erythritryl tetranitrate and penta-erythritryl tetranitrate. Next is a beta blockers. Beta blockers are examples like propranolol, metoprolol, atenolol, and others. Next is the calcium channel blockers. Here are calcium channel blockers. It was again subclassified into phenyl alkylamide. Example is verapamil. This is the structure of verapamil. Here we can see the two benzene ring which was attached by a flexible ring between the two benzene ring. This is a verapamil. Next is a benzothiazepine. Example is a diltiazem. Benzothiazepine. What is benzothiazepine? Which consists of an benzene and thi means sulfur and azepine means nitrogen. Here we can see the benzene group is present, sulfur and nitrogen, all the groups are present. This is an example of benzothiazepine. Diltiazem. Next is dihydropyridines groups. Dihydropyridine, so here we can see the basic of parastructure is in pyridine structure in it. An example of dihydropyridines is nifedipine, phenolidipine, amlodipine, nitrindipine, lactidipine, benadipines, lercandipines, and more. Next is a potassium channel blocker. In this example of potassium channel opener is in nicorandil. is a good example of potassium channel opener. Next, we are going to see about the mechanism of action. And this is the mechanism of action of the nitrates. See, first of all, the drug we are taking as which is a nitrate, which is then denatrated by the smooth muscles, and it was nitric oxide is released. This nitric oxide, which helps in the activation of the guanylyl cyclase GC. This guanylyl cyclase GC, which helps in the conversion of GTP to the cGMP, which helps in the melanonin light chain phosphate, which relaxes the vessels. So this is the mechanism of nitrates. Next, we are going to see the mechanism of action of the beta blockers. The mechanism of beta blockers, it shows the sympathomimetic actions on both the heart and also when just glomerular cells in the kidney, glomerular cells in the kidney. So in heart, which increases the cardiac contractility, thus increases in heart rate and also in cardiac output. And just glomerular cells in the skin, which increases the renin release, which causes increase in the angiotensin 2, and this increases in vasoconstriction also. And next is the mechanism of action of calcium channel blockers. Here the calcium channels, we have many channels in the cardiac cells, and one of is an L-type calcium channel. This calcium channel will be activated by the depolarization sensitization, and this is act as a gate. If this L-type calcium channel is open, then the calcium channel ions will enter into it, and which causes we know that calcium is always causes a constriction of blood vessels. So this calcium ion which will constrict the blood vessels. But in this calcium channel blockers, the name itself is blocks this L-type calcium channels, and it will inhibit the entry of calcium into this channel. So there is a decrease in the calcium ions. So there is no constriction in the blood vessels. So this is a mechanism of calcium channel blockers. Next, we are going to see the mechanism of potassium channel blockers. This potassium channel openers. This potassium channel openers, which will open the potassium ATPase. So once the potassium ATPase is opened, which means the potassium channel is opened, here we can see the enhance of potassium efflux. The potassiums or effluxes out through the channels. Thus, the membrane hyperpolarization occurs, which also decreases the calcium entry, which leads to a reduced intracellular calcium. That's why smooth muscle relaxation happens. So this is a mechanism of action of potassium channel blockers. And here we have seen classifications and their mechanism of action and some of the example drugs. And thank you for this opportunity.